Welcome to Public Health Brief. What if a single mosquito bite could put your life at risk? Every year, millions of people around the world become infected with malaria, a disease that continues to claim hundreds of thousands of lives despite being preventable and treatable. It often starts with a fever, headache, or chills, symptoms so common that many people dismiss them as a simple illness. But behind these warning signs may be one of the world's most dangerous infectious diseases. In today's video, we'll uncover the truth about malaria, how it spreads, who is most at risk, and the warning signs you should never ignore. We'll also explore the life-saving prevention methods and treatments that are helping communities fight back against this deadly disease. Stay with us until the end because the information you learn today could help protect you, your family, and your community from a silent killer that still threatens millions of lives worldwide. Imagine going to bed feeling perfectly normal and waking up with a fever, chills, and exhaustion so severe that even getting out of bed feels impossible. For millions of people around the world, this is often how malaria begins. At first, the symptoms may seem similar to a common flu or viral infection, but malaria is far more dangerous. Despite advances in medicine and public health, malaria remains one of the deadliest infectious diseases on Earth. It is often called a silent killer because it can strike unexpectedly, progress rapidly, and become fatal if treatment is delayed. Malaria is caused by parasites that are transmitted through the bites of infected female Anopheles mosquitoes. These mosquitoes are most active during the evening and nighttime hours, making people vulnerable while they sleep. The disease affects people of all ages, but children under 5 years old and pregnant women face the greatest risks. In many tropical and subtropical regions, malaria continues to place enormous pressure on families, healthcare systems, and national economies. The story of malaria begins with a mosquito bite. When an infected mosquito bites a person, it injects microscopic parasites into the bloodstream. These parasites travel to the liver, where they multiply silently for days or even weeks. During this stage, the infected individual may feel completely healthy and have no idea that a dangerous infection is developing inside their body. After multiplying in the liver, the parasites enter the bloodstream and begin attacking red blood cells. This is when symptoms usually start to appear. One of the reasons malaria is so dangerous is that its early symptoms often resemble those of other common illnesses. A person may develop fever, chills, headache, muscle pain, fatigue, and sweating. Some people experience nausea, vomiting, or diarrhea. Because these symptoms can look like influenza, typhoid fever, or other infections, people may underestimate the seriousness of their condition. Unfortunately, malaria can worsen quickly if not diagnosed and treated promptly. As the parasites continue to multiply and destroy red blood cells, the body's ability to carry oxygen becomes compromised. Severe malaria can lead to anemia, breathing difficulties, organ failure, and even death. In some cases, the parasites affect the brain, causing cerebral malaria, a life-threatening condition that can result in seizures, coma, or permanent neurological damage. This severe form of the disease requires immediate medical attention and intensive treatment. The burden of malaria is especially heavy in many countries across Africa. Warm temperatures, seasonal rainfall, and environmental conditions create ideal breeding grounds for mosquitoes. Communities living in rural areas often face additional challenges, including limited access to healthcare facilities, diagnostic tests, and effective medications. These barriers can delay treatment and increase the risk of severe illness and death. Children are among the most vulnerable victims of malaria. Their immune systems are still developing, making it harder for them to fight off the infection. In regions where malaria is common, countless children miss school because of repeated infections. Some suffer long-term health consequences, while others tragically lose their lives. Families often face emotional and financial hardships as they struggle to care for sick children and cover medical expenses. Pregnant women also face unique dangers from malaria. During pregnancy, changes in the immune system can increase susceptibility to infection. Malaria during pregnancy can lead to severe anemia, miscarriage, premature birth, and low birth weight in newborns. These complications can have lasting effects on both mothers and babies. Protecting pregnant women from malaria is therefore a major public health priority in affected regions. Although malaria remains a serious threat, it is important to understand that it is both preventable and treatable. Over the years, public health organizations, governments, researchers, and communities have worked tirelessly to reduce malaria transmission and save lives. Their efforts have led to significant progress, but the fight against malaria is far from over. One of the most effective tools for preventing malaria is the use of insecticide-treated bed nets. These specially designed nets create a protective barrier around sleeping individuals and kill mosquitoes that come into contact with them. In communities where bed nets are widely used, malaria infections have declined significantly. Sleeping under a treated net every night remains one of the simplest and most effective ways to reduce the risk of infection. Indoor residual spraying is another important malaria control strategy. This method involves applying insecticides to the walls and surfaces inside homes. Because mosquitoes often rest on walls after feeding, spraying can kill them before they have an opportunity to spread the disease to others. When combined with bed nets and other preventive measures, indoor spraying can greatly reduce malaria transmission. Environmental management also plays a key role in malaria prevention. Mosquitoes breed in stagnant water, so reducing breeding sites can help control mosquito populations. Communities can contribute by draining standing water, cleaning drainage systems, covering water storage containers, and maintaining clean surroundings. These actions may seem simple, but they can make a significant difference in reducing mosquito numbers. Public education is another powerful weapon in the fight against malaria. When people understand how malaria is transmitted and how to protect themselves, they are more likely to adopt preventive behaviors. Health campaigns often encourage communities to use bed nets, seek medical care when symptoms appear, and participate in mosquito control activities. Knowledge empowers individuals and communities to take action against the disease. Diagnosis is a critical step in malaria management. Modern healthcare facilities use rapid diagnostic tests and laboratory examinations to detect malaria parasites. Early diagnosis allows healthcare providers to begin treatment quickly, reducing the risk of severe complications. People living in malaria-prone areas should seek medical attention whenever they develop fever or other symptoms suggestive of malaria. Treatment for malaria has improved dramatically over the years. Today, highly effective medications are available to eliminate the parasites from the body. The choice of treatment depends on several factors, including the type of malaria parasite, the severity of illness, and local treatment guidelines. When treatment is started early, most people recover fully. Delayed treatment, however, can have devastating consequences. One of the challenges facing malaria control programs is the development of drug resistance. Over time, some malaria parasites have evolved resistance to certain medications, making treatment more difficult. Scientists and healthcare professionals continuously monitor resistance patterns and develop new treatment strategies to ensure that patients receive effective care. This ongoing battle highlights the importance of research and innovation in public health. Mosquito resistance to insecticides is another growing concern. In some regions, mosquitoes have become less sensitive to commonly used insecticides, reducing the effectiveness of prevention measures. Researchers are exploring new technologies, improved insecticides, and innovative mosquito control methods to address this challenge. Continued investment in science and public health is essential to stay ahead of evolving threats. Climate and environmental changes can also influence malaria transmission. Rising temperatures, changes in rainfall patterns, and environmental disruptions may create new opportunities for mosquitoes to thrive. As a result, areas that were previously less affected by malaria could become more vulnerable in the future. Public health experts are closely monitoring these trends to develop strategies that protect communities from emerging risks. Despite these challenges, there is reason for hope. Scientific breakthroughs have opened new possibilities in the fight against malaria. Vaccines against malaria have been developed and introduced in some countries, offering an additional layer of protection for children living in high-risk areas. While vaccines alone will not eliminate malaria, they represent an important milestone in global health and have the potential to save many lives. The fight against malaria is not only a medical issue but also a social and economic one. Malaria affects productivity, education, and economic development. Adults who become sick may be unable to work, while children may miss valuable school days. Families often spend significant resources on healthcare and caregiving. By reducing malaria, communities can improve health, strengthen economies, and create better opportunities for future generations. History shows that malaria can be defeated. Several countries that once struggled with widespread malaria have successfully eliminated the disease through sustained public health efforts. These successes demonstrate that elimination is possible when governments, healthcare systems, communities, and international partners work together toward a common goal. Every individual has a role to play in preventing malaria. Simple actions such as sleeping under a treated bed net, using mosquito repellents, wearing protective clothing, keeping living areas free from mosquito breeding sites, and seeking prompt medical care can make a substantial difference. Community participation strengthens public health efforts and helps protect the most vulnerable members of society. The story of malaria is ultimately a story about awareness, prevention, and action. It reminds us that even tiny insects can have enormous impacts on human health. It also demonstrates the power of science, public health, and community engagement in overcoming major health challenges. While malaria continues to claim lives, every preventive measure taken, every diagnosis made, and every treatment provided brings us one step closer to a world where this disease no longer poses a threat. As we look toward the future, continued commitment to malaria control and elimination remains essential. Governments must invest in healthcare systems, researchers must continue developing new tools and treatments, and communities must remain vigilant in protecting themselves from infection. The progress achieved so far proves that change is possible, but sustained effort is necessary to maintain momentum. Malaria may be called the silent killer, but silence is exactly what allows it to thrive. Awareness, education, and action are the keys to defeating this disease. By understanding how malaria spreads, recognizing its symptoms, embracing preventive measures, and supporting public health initiatives, we can help protect ourselves, our families, and our communities. The fight against malaria is far from over, but it is a fight that humanity can win. Every life saved is a reminder that prevention works, treatment works, and collective action works. Together, we can ensure that future generations grow up in a world where malaria is no longer feared as a silent killer but remembered as a disease that was overcome through knowledge, determination, and global cooperation. If you found this video helpful, please like, share, and subscribe to Public Health Brief for more trusted health information that can save lives. Turn on the notification bell so you never miss our latest public health updates. Share this video with your family and friends because awareness is the first step toward prevention. Together, we can build healthier and safer communities for everyone.